Hi, I'm Dr. Jim DeBlasi of the Ackworth Wellness Center, and I am so excited to share with you how our clinic is going to help you eliminate the pain that you're suffering with. For those of you who are not familiar with the term regenerative medicine, I do want to define it for you. So regenerative means by definition the ability to make something new or to bring it into existence again. We're talking about making your joints new again. A great analogy is a lizard. I'm sure you know about the lizard that can break off their tail and grow a new one. They can do this because they have cells of regeneration. You and I don't need new tails, but we do have cells that help us regenerate too. In fact, when you were born, you have hundreds of millions of these regenerative cells. This is why when you're young, you can heal very quickly. But when you become older, you start to lose these cells because they go dormant. And as a result, when our youth is over, we develop what are known as degenerative diseases. So as adults, we are working on only about 10% of the healing power that we were given at birth. This healing ability to stop or slow down degeneration and to make new tissue naturally is what we are going to talk about today. I personally had a regenerative treatment because of pain I had in my thigh for over 18 years. And I tried lots of different treatments, but every morning I woke up with left thigh pain and difficulty in walking. I could no longer ride my bicycle or play tennis. And one treatment, the pain was gone. Now that's been about 6 or 7 years ago, and it still has not returned, and I do now ride my bike and take hikes and have no pain. Many of you are here because you have knee pain. Karen is a 63-year-old who had bad knees. Her pain started in her 50s and got worse as she got older. The best way to describe the pain would be completely life interrupting. She had to ice her knees every day, and she would take tons of medication. Her doctor told her the only solution was surgery. Karen was terrified of surgery as her mother passed away from anesthesia and complications. But the final straw for Karen was when she went on a beach trip with her daughter and grandchildren. But she could not walk along the ocean with them because of her pain. So like you, she saw an ad for our clinic on Facebook, and she attended one of my talks. After her treatment, her life changed dramatically. She reported that her pain went from a 9 down to a 3. She could sleep at night. She could exercise, and her only regret was not doing this sooner. So let's discuss some traditional treatments for joint pain. These include over-the-counter medications, opioids, icing, wearing a brace, using a walker or cane, getting cortisone injections, and we're going to talk more about that later, or as Karen was told, surgery. But she decided not to do the surgery. Something I want you to consider is that these approaches are not actual solutions. They are actually just band-aids. And I'm pretty sure that everybody here has tried to solve their joint pain problems with over-the-counter pain medications such as ibuprofen. When people experience pain, they often turn to these drugs. But this is actually not stopping the degeneration that's happening within your joint. It doesn't reverse it. In fact, these over-the-counter medications can actually make your problem worse. They can make you think you're better when you are not. And then you use these joints in a way that you shouldn't. Here's another story. This is Betty. Betty was 40 years old when she came to see us. She was an avid tennis player and her entire social life was structured around the game. She played the game on weekends with her friends. She practiced on weekday mornings with the trainer. She belonged to a tennis organization that hosted tournaments to raise money for charity. Then She suffered a rotator cuff injury to her shoulder during one of those tournaments, and she was absolutely devastated. She was sidelined not only from the game, but her entire social support structure as well. She had limited mobility. She ended up gaining weight. She had trouble sleeping, and she began to worry about her mental state. She was becoming really anxious and depressed. Her first doctor did 3 rounds of cortisone injections into her shoulder. Betty reported that every injection helped for a short period of time, but within a month or two, the pain would return. Again, we're going to talk more about cortisone in depth. So she came in for an exam and a treatment. Over several months after her treatment, her range of motion improved dramatically, which never happened with the cortisone injections. Her pain decreased, and she actually felt better as time went on. Eventually, she was confident enough in her body's healing to pick up the racket and play tennis again. So, like Betty, many people have tried cortisone injections, and it's important for us to make sure that you understand that there are risks involved. This is something that many doctors will recommend before moving you to surgery. It's important to understand that a cortisone injection will not last forever. It may only last a few months, and again, it's a band-aid. It's not an actual solution. Cortisone is not regenerating any cells. It's not healing your body. It's literally just a band-aid for the joint pain. In fact, if you have too many injections, it's known to actually degenerate your joints. And the FDA tells doctors to limit it to 3 shots in one joint in a lifetime. If you're diabetic, cortisone shots also have other side effects on your body. It raises blood sugar. So definitely, this is something you want to avoid if at all possible. So when drugs fail and when cortisone shots are not an option, the only alternative that people are offered is surgery. And as you know, all surgeries have complications. Now, according to the National Inpatient Medicare Database, 4,964 deaths were due to knee replacements that were reported in one single year. Now, if you add the blood clots to the lungs, heart attacks, and pneumonia during the related surgery, that's another 10,000 people that died, and that doesn't include the 17,500 people who were reported to get post-surgery infections. Knee replacement surgery also costs a lot of money. Up to $57,000 will be billed to your insurance, but you may have to cover up to $20,000 out of your pocket. And then on top of that, you're going to need 3 to 6 months of rehabilitation. And how much money would you lose during that rehab time not being able to work? I hope those of you that are here have not already had a knee replacement or joint replacement surgery. And many who have gone through that experience actually came out in just as much pain after the replacement. Unfortunately, this is extremely common. Once the joint replacement has been made, we cannot help you. That is why we tell people to do this treatment first, because you can always have a replacement should this treatment not give you the full results that you want. But you cannot do regenerative medicine once you had replacement surgery. And again, even with good insurance, joint replacement is very expensive, painful, time-consuming, and life-interrupting. It should truly be your last result. So today, we're going to talk about a solution to degenerative pain-related problems that is safe, effective, and affordable. I mean, you've probably been told that your pain is normal, that it's a normal part of aging. And to some extent, it's maybe true. But you lack degenerative cells of your youth. And there is a way to replenish your body with these regenerative cells naturally. That's what we're going to talk about today. I do want to let you know that this will be for many of you today, a turning point in your life. I would not be here if I did not honestly believe that what you're going to learn here today could dramatically improve and change your life. To give you the ability to go up or down steps without pain, to be able to go out and play with your grandchildren or children, to be able to go on long walks with your spouse or friends. This is stuff of what life is made of. The products that we use in our clinic are biological, which mean they come from living organisms. These regenerative cells are the cells that can build things. They can come from your own bone marrow, or they can be donated at the time of birth. This has nothing to do with abortions, and we're going to cover that in a moment. Again, one way you can get these cells is from your own bone marrow. However, that's not actually the best ideal choice. Don't forget that part of the reason why you have joint pain problems in the first place is because you have lost many of the naturally occurring regenerative cells in your body as you aged. Extracting any of these cells is often very painful, and it's surgery. And that can take nearly an hour. And again, you're using cells as old as you are in this scenario. The next story is a great example of why you don't want to use bone marrow stem cells. This is Julia. She's 75 years old when she came to see us, and as a senior with some underlying health conditions, she would not have fared well with harvesting procedure. And as you can be sure that her naturally occurring stem cells were degraded, Julia was having a lot of problems with her mobility. Her children were starting to talk about putting her in a nursing home because she was having trouble navigating the steps in her home. She had gone to an orthopedic surgeon who told her that the only solution was to have bilateral knee replacement surgery. But she decided to have bilateral regenerative stem cell therapy instead. 1 month after her treatment, she had 0 pain in her knees compared to before when she was at 10 out of 10. Now I tell you the story because if it will work for sweet 75-year-old lady, it can help you too. So, what are stem cells anyway? Let's dive in. Remember, when you're born, you have millions and millions of stem cells. But over time, our bodies degenerate rather than regenerate. So we know that a bone marrow extraction is not ideal. Cells from a birth are young and they contain much greater healing potential. An injection of this type can be delivered in 15 minutes and it's less costly and less painful. When a woman has a C-section or cesarean delivery, she can choose to volunteer to donate her umbilical cord, placenta, and amniotic fluid that surrounds that baby. Last year, 1.35 million women in America made it through the intensive hospital screening process and associated blood work to make sure that they harbor and carry no diseases. And they were selected to give this incredible gift, and they donated them. So people who need these regenerative stem cells could get them. Once these tissues and these cells are carefully screened, they can be transferred into your body. This gives you the healing power that you once had when you were an infant yourself. These mom are doing something so amazing by donating these tissues that would otherwise be just thrown away. They're giving other people the ability to heal. Remember, these healing, powerful cells of regeneration include stem cells that are dormant inside your body. When we do this injection of the donated tissue, the first things these donated tissues do is wake up your dormant cells. Your body is going to heal itself. and we're going to do it is help your body bring about that results. Now, there are no abortions involved, and because cells are a blank slate, they cannot be rejected by the person that receives them. These cells from a new baby's birth can activate dormant cells that regenerate tissue, reduce inflammation, and restore normal joint function. You know how when you're around kids and they have this youthful energy, it's contagious and you feel younger again? It's almost like these injections. They are working on a cellular level. When you receive regenerative medicine, the body accepts these cells as if they were your own. And now that they're in there, they will help cells form. So 1 million cells become 2 million, then 3 million, 4 million, and 8 million, 50 million, 100 million. They will continue to multiply and heal for up to 8 months. So at this point, you probably have some questions. Maybe you wrote them down as I talked. So I also wanted to discuss the next step. And again, this is a lecture. I talk to you and you listen, but what really happens next is we need for you to come in for a consultation and examination. We need to learn about you. We will learn how you've been struggling with joint pain and discuss what you've tried in the past. We'll help you determine if you would be a good fit for us. So make an appointment for us to talk with you. So please look at your schedule. Take a look and see if there's a day or time that is going to work best for you. We are truly devoted to helping people live a better life. And I'm definitely not saying that we can help everyone. But what I am saying is we only accept people that we honestly believe we can help. That's why we have such a successful reputation. We have patients who come to us not only from our town and not only from our state, but from other states as well. We have patients who come to us because of our amazing results and because of our attitude of how much we care about our patients. We pride ourselves on our attitude and how we take care of you. You're like family, and we hope that you will have a much, much better life. So again, what I want you to do is pick a time and a day that we can have a consultation and examination and get all your questions answered. And again, I want to let you know, we don't accept everybody who comes to us. We only accept people who we honestly and sincerely believe that we can help. If we don't feel like we can help you, we are not going to waste your time or your money, and we're going to let you know. Remember, my purpose is to help as many people as possible. And we only want to help those that we know we can help. So, before we look at solutions for you or a loved one, I want you to answer some of these questions. Is it in your knee, your shoulder, your hip, your ankle, your foot, your elbow, your back, your wrist, or your hand? All of these areas are appropriate for this type of treatment, and we can help. If you have pain, decreased motion, or swelling in any of those areas. My next question for you is when it's at its worst and you're not taking medication to mask the pain, how would you rate your pain? And it's important to look at how your pain is affecting your life too. How is it affecting your mood? Is it making you more irritable? Has it reduced your energy? Has it restricted your movements and your activity? Has your joint pain made you a burden to your spouse or your family? Are other people having to do things for you because you can't do them for yourself anymore? Do you have sports that you loved, but now you can't play because of your problem? Maybe you loved exercising, you loved yoga, or you loved Pilates, but you can't even walk any longer. Is it reduced your enjoyment for life? I want you to include all of that in your rating. So, your answer is likely pointing to the fact that you have a problem that has not been treated successfully. Remember that degenerative diseases like joint pain only get worse with time. You've probably tried different drugs, different treatments, and likely they only gave you temporary relief. That's why you're listening today. So we want to give you a renewed experience of life, not temporary, but permanent. And all of these symptoms point to the fact that whatever you've been doing before has not successfully solved the problem. The lizard would not get a new tail if it had a cortisone injection. It would not get a new tail if it had Oxycontin. It would not get a new tail if it went to rehab and learned how to stretch or exercise. The only way you can rebuild these tissues that God gave us is through regenerative cells. And your body has lost most of these cells as you age. Then we can put new ones back inside of you. Another favorite analogy I have is your car. If your oil or check engine light came on, you could put tape over the light so you wouldn't see it. But does that make it better? This would be like taking drug. For your joint pain problem. You wouldn't feel it, but it would still be there. You know, the one thing that I always talk to people about is that you have two choices with any problem in life. You can keep doing the same thing, or you can try something different to resolve the problem. Now, just like the car check engine light analogy, it's important to understand that different joint problems have different solutions. So we've talked in general terms about how we help people, and it's depending on the diagnosis of your specific problems. There are different tissues and different protocols for what should be transplanted. We are definitely not a cookie cutter clinic. We need to discuss your unique circumstances and learn more about your history because there are different protocols and they really work well for different circumstances. All of our injections, however, work to actually address the underlying problem. So our injections are going to help reduce or eliminate your pain by reducing inflammation and minimizing scar tissue, promoting soft tissue growth, and generating new bone cartilage, ligaments, and nerves. I also want to let you know about our policy in regards to this subject of money because money is usually on people's minds. They always want to know how much is it going to cost. So we have a policy, and our policy is that we never let money get in the way of helping someone. If we accept the fact that we can do something to help you, and you accept that fact, we will try our best to find something that works and will fit within your budget. So now let's answer some other questions that I often get when people are at my seminar. The first one, of course, is how much does it cost and does insurance cover it? So at present, insurance has not yet covered these methods. But remember our policy is that we never let money be a barrier to helping people. So if regenerative medicine is not in your budget, then there are other natural healthy solutions that you will most likely be able to afford. Another question, do I need to be tested to make sure my body does not reject the transplanted tissue? And this is a great question, but the answer is no. You do not need to be tested because the tissues we use are immune privileged, just like the mom's body will not reject the baby growing inside of her. So when the tissue is injected into your body will accept it as if it was its own. And those regenerative cells will go to work identifying the areas of your body that needs help and needs healing. It starts building new cells. Another question, does the injection help? Does it work for everybody? Well, these treatment options can help most people, but not everybody. And as I'm sure you can imagine, we're pretty good at identifying who will and will not benefit from each type of injection. This is a great concern to talk about during the consultation. The injection does not hurt as we use a localized numbing solution, and the pain, if any, is pretty minimal. Plus, as I always tell people, temporary pain is better than a lifetime of pain. There are different amounts of tissues and different types of cells that we will be injecting depending on the type of and severity of your problem. This is not one treatment for every person. It's not the same treatment for every possible joint in your body. That's why we do need an MRI or X-ray to review and then diagnose the exact cause of your problem. And then based upon that, my team will provide us, we go over it all, with the type of treatment and the amount of cells and which different types of cells to use, and then what protocol is necessary. So we design it just for you. So I'd like to conclude our presentation by offering each of you the most precious gift that I can. And this is the chance for you to have a happier and healthier life. And I want to give you the opportunity to take that. The opportunity to become pain-free and happier again is something you should always give yourself a chance to have. This is one of the most important things in life, happiness. And I don't know anyone who's in chronic pain who can enjoy life the way the rest of us can. As I mentioned earlier, if we don't believe that we can help you, we won't accept you. And we're going to tell you that. If we can't accept your case, of course we can't take you on. If we feel that there's something better for you out there than this, we'll definitely let you know. So please, book your consultation and examination. There are a limited number, and we will try to fit the time and day that works best for you. This appointment, which will include a consultation, a physical examination, and review of any imaging, films, or reports that you have, normally costs $297. So if you can send me the x-rays before, then it'll give me a chance to set up everything for our consultation. But if you don't have x-rays, I'll be more than happy to give that to you for free of charge on me of that joint. But because you took the time out of your schedule to be watching this, I discounted this to $47. So in conclusion, I want to thank you so much for listening. I hope you learned a ton of information. I hope you learned that there are new options out there, and there are advancements in medicine that encourage healing from your body. It can help you heal and lead a happier and healthier life, and I encourage you to book that consultation and examination. I definitely suggest that if you have a spouse or significant other, that they join you during that time. I think it's always a good fit for them to hear what's going on with you and what we need to do. And this way we can also get their opinion. I look forward to talking with you soon. And again, I want to thank you so much.